Hi.
Hello. Not again.
Hello.
Well, hello.
We're back.
Episode number 6.
Six
And in quite succinct time.
2 weeks.
2 weeks ago.
It's a record.
Although, yeah, assuming you'll get this in a period of 2 weeks after this one. After the last one.
I'll behave and then there'll be less editing. So, if you don't know who we are, why don't you know who we are by now? I'm Honey.
I'm Andrew.
And we're Wilde Earth Journeys.
We are a community interest company based in the Forest Green, connecting people with nature to improve well-being and to make nature accessible.
Yes. Lovely. And today we're at Sudley Ponds.
We are, which is one of the venues we bring our community group to, which is it's really accessible. I think it's really accessible.
All our community walks are accessible.
They are, and I think we've spoke about how we talk about accessibility because it's too easy to make things. They've got to be clinical, sterile, flat. So I think Sudley Ponds is an accessible venue or place to come. I'm not saying if you're in a wheelchair.
Yeah, I was just thinking that. I was like,
it is
accessible,
bumpy,
but there's levels of accessibility, aren't there? So some of ours are fully accessible trails, including Linear Park, because obviously they've just redone the surface of that track there, and the Glade Trail up at Beechenhurst is a fully accessible trail, and they're beautiful trails. They're super smooth and easy for anybody in a wheelchair or like a mobility scooter.
Yeah, and I say
this is a little bit bumpier.
It is a little bit bumpy. I've used that's kind of exactly what it is. You just got to go. But it's an excuse to slow down because I would bring my mum here in a wheelchair, and yeah, it is a little bumpy, but it's
you don't
okay.
like your mum very much. Shaking her teeth out.
But slow down, and it's fine.
Yeah, absolutely. Okay, so last time we talked about our community walks.
We did.
And we asked for some volunteers. We're still asking for volunteers. We've had a few people come forward, which is fantastic. Thank you very much if you've made contact with us, actually, off of the back of our last podcast, and offered your time. We really appreciate it.
Yeah, absolutely.
This is off of the back of a programme that we've finished recently, Nature on Prescription. A pilot programme we ran with the Forest Green
PCN.
Primary Care Network. Let's not get too NHS-y on our
acronyms.
Poor viewers, yeah. Just before Christmas. And so we're going to have a chat about that today because we spoke about it. We presented it yesterday, didn't we?
We've done a couple of presentations recently just to kind of go over the findings and the results. Nature on Prescription.
And the response and feedback has been a bit mind-blowing, hasn't it? From both ends of the spectrum, from the people that took part and from the people that have funded it. And
what is it? What is Nature on Prescription?
So, Nature on Prescription is I keep saying 6-week programme. It's not really, it's an 8-week programme. An 8-week programme based around the principles of forest bathing. So being mindful out in nature. And it was targeted at people with mild to moderate mental health issues. And it came through as a GP recommendation.
Yep.
So if anybody went to go and see any of the doctors in the Forest Green PCN, they would, if they thought they were suitable, recommend Nature on Prescription as a programme, similar to recommending talk therapy or a course of medication. So it's like a third option for people.
Yeah, absolutely.
And we ran our 8-week programme before Christmas. First session being a pre-meet at the GP surgery, Forest Healthcare in Cinderford. And then 6 weeks of walking. First week being from the surgery. And then actually led by the group because the plan originally was to do all of the walks from the surgery.
Yep.
But our group decided they'd like to go and explore new places.
Yeah, so we opened up the opportunity to visit some of the places that we know well.
Yeah.
And yeah, each week we check in to see what they thought
That's
of our
why we're
suggestions.
so good.
Well, yeah,
Literally fully led by the group that we are supporting.
Absolutely. And I think also, so each of the 6-week physical walking had a theme.
Yep.
And...
Do you remember what the themes are?
No.
No, I was just thinking, I couldn't even tell you what those themes were.
No, I can't right now. And...
It was stuff around gratitude, connection.
And what stands out, and what it means. Again, though, we had a theme, and it was led still by the group.
Oh, absolutely.
Because on any given day, life happens. And so, it's having those initial kind of conversations, checking in and setting off with an intention, and then making the programme fit.
There's something in that though, isn't there? And I think it's a conversation we've had with people before, that actually when you take people outside and you remove, for want of a better word, the clinical setting where you're sat in a sterile room being done to, rather than being held or taken on a journey with, actually that's where the magic happens. So there's something about allowing someone to come into a space where everybody's on a level ground. There's not this perception of any professional hierarchy. People can just come and allow and be themselves.
And I think what you mentioned there about everybody being on a level ground, that's why it's so important to have that initial meeting, so that you meet everybody.
Yeah.
And we have those kind of initial conversations of, nobody has to say anything they don't want to, and we're not asking for people to kind of reveal anything personal, but it's just a cup of tea, cup of coffee,
slice of cake.
Chat. Yes, okay. It's just a chat of who we are, what we do, and this is our intention, and do you want to come along for the journey?
And that's probably what made part of this so successful, is that everything in the NHS is 6 weeks, 6-week programmes. And you kind of get thrown into a 6-week programme and then dropped off at the end of a 6-week programme. And having done the community walks and been involved with lots of this stuff for the last 5 years now, and especially when you're talking about people with mild to moderate mental health, so issues with anxiety and things like that, and that whole visit before the visit, an opportunity to meet us as walk facilitators, and the rest of the group that you're going to spend 6 weeks with, as well as actually find out about what you'll be doing and get a general vibe. It's so important to actually go in, I'm okay with going along to the first session. Yeah,
and we appreciate that that's not always easy for some people. And, we've had some conversations with individuals that, again, make that achievable. So that is what Nature and Prescription is, because I say is because we want to do more.
We do.
And I think it's worth saying that, this first pilot here in the Forest of Dean, it's really come about with the amazing collaboration of Dr. Boyd, who's really been working, it's been an amazing collaboration. And she's
super passionate about nature. I remember her saying, actually, to the group of GPs, we're doing our patients a disservice by only offering talk therapy and medication, when we know there are other valid methods of helping people feel better, of helping people reduce their anxiety, of helping prevent isolation. She's a massive advocate for nature and what nature can do for us in terms of well-being and health.
So we've monitored the programme over the course it was running, and we've actually got our first kind of post-course meetup next week, which is probably
it's not our first, it's our second, because the guys came to the farm to meet the ponies.
Oh yes,
yeah,
of course. Yeah, I forgot that. But we've spoke in presentations recently about data, and what's really interesting is in our presentations we've been asked to give recently, we've been starting off, or it's been stated that we no longer really have to state how nature is good for us because it's accepted, it's known. So we're really now coming down to the nitty gritty and for one of the cost benefits. Because
crunchy data.
The crunchy data. And at the same time, I think here, bear with me.
It's a really large wasp.
So hopefully, this is part of another project. Some filming that's going on behind the scenes. Multitasking. So going back to the program, I think here I want to outline the benefits of being out in nature, and for one of the intended, not the intended changes we were seeking to create, but we were inviting people into and to make their own changes that are right for them.
Yeah, it's an interesting one, isn't it? Because especially when you work within healthcare, the expectation is there'll always be some kind of measurable outcome. And we've always come at it with zero expectations, because it's about meeting people where they're at right now, holding space for them to allow whatever comes up to come up, and them taking what they take from it, which is always, I mean, there are themes, but it's always individual to that person.
Yeah.
And the great thing is we don't have to bang the drum anymore about how nature is good for us, because we all know that, and it is widely accepted. There's 40 years of research now which shows the actual health benefits of being in nature, and anybody watching this will know that actually if you go and take a walk out in nature, you always feel better. We know intuitively that being out here is beneficial for us.
Absolutely. And and the evidence is out there, like you said. So, mood, blood pressure, so much. And I think
those NK...
Oh, the NK...
Killer cells?
NK killer cells. Yeah, I was like, I haven't said that word for a while.
I know! I was waiting for you to say it and you didn't, because that's normally... So you normally go on about that.
Boosting your immune system. Now, and that all that data is out there, and it's then not the intangible, but the things that you can't could have put a pin in. It's the changes in the person, in the sense of self, and the engagement, the sense of empowerment.
That line between what you can measure and not measure.
But you can witness.
Yeah, that's where the real magic happens for me.
Yeah, and I think it's been such a privilege to be part of this program and to witness the changes in the individuals. And I think it's not a one-way learning, because we're learning all the time, and no two sessions are the same, and no two programs will be the same.
No, absolutely depends on the group of people that we've got and the dynamics of the group, and so many other factors that come into it. But I've said this, I feel like I've said this loads of times over the last couple of weeks, but that is the beauty about having an organisation like us, who are part of the community and have worked in the community for so long, who know our community really well, and we do what we do out here really well. I'd go so far as to say, we're kind of experts in this field now.
I believe so.
Let's just put that out there. Yeah. We're bloody good at what we do.
Still open to learning.
No, well, nobody knows everything, but I think that's the success of our very first pilot has been a combination of all of those things.
Yes.
And it's the beauty of organisations like us picking up or picking up the slack, or mopping up those people that are struggling to access all the services that are out there at the moment, because they're so overwhelmed. And we've got something which has provable benefits, absolutely measurable, and those intangible things as well that make people's lives just that bit better. So whether it's somebody that previously wouldn't have left the house unless they absolutely had to, now going out and actually connecting with their community and socialising, and the ripple effect of that out through the families that they're in as well.
Absolutely, sharing what they've learnt with us, with friends, with family, even revisiting the places we visited together. And I think, and
it's a beautiful thing.
It is. and going back to, I think, what we do well, we collaborate. It's the, again, signposting to other services and organisations that we work with when needed, to work with us. It's not just one thing. We're not saying you have to work with us and nobody else.
Oh, we're not precious at all.
No,
people pay lip service to collaborative working and partnerships, and actually it's not something you see in its truest, most authentic form very often. But we do work with lots of people locally and lots of organisations locally. And the wonderful thing about the Nature on Prescription programme was that actually when we met up at the GP surgery for our post-programme meet, it wasn't just about, can you fill out a feedback form and let us know how we did? It was an invitation to join our free community wellbeing walks and be part of that community. An invitation to join our drop-ins on a Friday at Hips Cafe at the Tap in Littledean.
Yep.
An invitation to inquire about any of the other organisations or services that we know are available to them that we can put them in contact with. So it's never just a 6 week and done. And actually, we are meeting up with the GP group again next week.
Next week, absolutely.
And this will be their second time post-programme that we've met up, because they were invited to come and meet our herd of wonderful ponies not long after we finished the programme as well. And they have created their own little community via a WhatsApp group where people share stories and poetry and pictures of their walks that they're still going on following the programme.
Yeah. It is. It's all about community, re-engaging community, and allowing people to do it at their pace.
Yes.
So important, as you said, to allow people to have continuity after. So the dropping, if people want to join us on that on a Friday, and the community walks, which are every week.
Starting on the 10th of
Feb
February.
Is the next one in the Arboretum. So that means I need to get this video out before that now.
Yes, you do.
I've never mentioned the date. So I think the Nature on Prescription has been program. Oh, I know, it's not that funny. Just in case the mic didn't pick it up. It was a laughing duck. That's the best way I can describe that. Yep. It's been a great success, and we want to do more. We were lucky enough to receive funding through the Forest Green District Council to run this initial pilot.
Thank you, Gary and Lena.
Yeah, absolutely.
Massive advocates for the well-being stuff, actually for the Forest Green community. Again, people who are super passionate about it.
Yeah. And we want to do more. And right now, we are working towards an evidence base. And this working towards isn't just us, but we're working toward everybody to get national funding. What have I said now?
No, I can just see this going into, so if you'd like to donate £5 a month.
Subscribe now.
No, we are. I mean, what our long-term goal, along with some of the other places that have been running very similar programmes to ours, and this is just a process of collecting data, not just on well-being measures, but but also on things like cost benefit, because the dream for all of us would be a national programme where if you are feeling low or anxious or you've got anything else going on, this is a viable third option where either as an alternative to or alongside talk therapy and medication, you have a programme where you get to be part of a really lovely community, and you get out in nature and you kind of rediscover joy and what it is that makes you tick and all the wonderful things that life is supposed to be about, as well as how to deal with when things aren't great. I mean, one of the most powerful things that one of our participants mentioned was, actually, since I've started this programme, so much has gone on in my life that it hasn't been great, but I feel I can deal with it. Yeah, absolutely. I have a new perspective. Yeah. I mean, how powerful is that? So that's the dream.
It is.
A national commissioned programme of nature for people.
Yeah. And it's an example of the collaboration. We're working with organisations around the country, primarily through nature and therapy. who we collaborate a lot with. And
So we did our training through
do our
originally.
training,
Yeah.
and
we
support.
we help them run their advanced forest bathing course in the Forest of Dean because it's a wonderful place to be, and we're incredibly lucky to have such an amazing natural resource.
So that's nature on prescription.
So if you are a commissioner,
If you're a
a
commissioner,
councillor, or anybody with a pot of money that's passionate about nature and the ability of nature to help us heal and to grow and to feel better, then please do get in
please let us know.
contact.
And I think it's, we're with anything we are doing, we understand around sustainability, and we're not looking for endless handouts, which is why we're working towards this data collection collaboratively around the country. So what we're looking to do really is, we know there's a certain number that we're going to have to run ourselves independently through collaboration and through support. So that's where we are right now, but we're not naive. We're looking to make this sustainable in the future.
Yeah, well, we've done, and this is a bit of a first for us actually, isn't it? I think our reporting has evolved and grown over time, as we have, and in line with the programmes that we've been involved in. And this time, actually, it was really pertinent to say, what is the cost benefit of this, and what is the social return on investment? Because actually, when you get people feel better about themselves and able to leave the house and able to interact and be a positive part of their local community, they're more likely to go and volunteer or go back to work and all that kind of stuff. So all these really pertinent questions around, because everything comes down to money.
Yes.
And funding, and actually, as NHS or Department of Work and Pensions, if we're putting money into something, what are we getting back in return? And we have this time proven that actually, I think in the first year, and it goes up as the years go on because of the longer term benefits, but in the first year, something like £1.30 return for every pound spent. Super conservative as well. So
we have the data.
Yeah, we got
and
some
if it's
nutty little
relevant
reports
for yourself, then just reach out, ask, and we're happy to
share anything.
Absolutely. So, are we being succinct and we're stopping? Are we going to then leave the rest for another episode?
Yeah. What's the rest? What are we talking about next?
What are we going to talk about next? We could talk about the drop-in. We could talk around accessibility. Actually, accessibility is a passion for us, and I think it'd be amazing to talk a little bit more around accessibility. Perhaps, yeah.
Yeah, or if there are people that want us to go and walk around certain routes, or talk about in bulks, really around the corner.
Mm-hmm.
So seasons, and happy to include some of the stuff that we would anyway. So around trees and the benefits, and
of course,
even some of the mythology. So we can talk about.
There's a lot. There's a broad spectrum.
We can talk about anything.
Okay, so
we're done.
We're done. Yeah. Okay.
Wow.
We'll see you on the next one.
We're getting good at this.
Yeah. Bye for now.
Bye bye.